Hello and warm welcome to today's webinar, Worldwide Voices, Perspectives in Tackling Lead, organized by the Green Growth Knowledge Partnership, GGKP, together with UN Environment Programme, the Basel, Rotterdam and Stockholm Conventions, and WHO. I'm Stephanie Vidorini, the manager of the Green Forum, an interactive online community of the GGKP that hosts the Chemicals and Waste Management Community of Practice together with the SciChem Secretariat to promote the sound management of chemicals throughout their life cycle. This community of practice has hosted a series of discussions this year on chemicals and waste management. Topics have included integrated chemicals and waste management, chemicals and waste management in SMEs, chemicals in plastics, and capacity building and reporting. We encourage you to join this community. Check out our previous discussion summaries through the link in the chat box and share your insights or experience. In today's webinar, we will hear from different stakeholders on how low and middle-income countries can leverage global mandates and recent decisions related to lead poisoning to safeguard their communities and curb damage caused by lead exposure. Despite remarkable progress, lead poisoning remains a serious threat around the globe, particularly in these countries, where almost 1 in 3 children is still exposed to unsafe levels of lead, primarily from paint, toys, and electronics. It was therefore heartening to see G7 members share their renewed commitment to reduce lead exposure in vulnerable communities at the G7 Annual Summit. Some of the actions proposed include strengthening the linkages between environment, health and development, as well as ensuring adequate institutional capacities in the low and middle income countries to develop, implement, and enforce actions to prevent and reduce lead exposure. Following this monumental moment, in the 5th International Conference of Chemicals Management, or ICCM5, in Berlin last month, representatives from governments, the private sector, NGOs, IGOs, youth and academia agreed to establish the global framework on chemicals for a planet free of harm from chemicals and waste. To unpack the significance of all these actions, today we have Angela Bandemir to guide the discussion with our distinguished speakers. Angela is Acting Senior Advisor in the Office of International and Tribal Affairs of the US Environmental Protection Agency, where she has been working since the year 2000 on establishing and implementing effective international partnerships and projects to address global environmental issues, including air pollution, chemicals management, and lead in paint and gasoline. She is currently coordinating US engagement in the Global Alliance to eliminate lead paint and with the G7 on lead. She has been with EPA since 1992. So without further ado, please let me hand the floor over to you, Angela.
Great. Thank you very much, Stephanie, for that introduction and the overview of the webinar. I would like to welcome everyone today. I see we have a good number of people from many different regions, and we welcome you here to discuss this exciting topic on perspectives on tackling lead, and to hear from all of you your questions, and to hear from the panelists on their view and what they're doing in this area. As Stephanie said, there have been increasing discussions over the past years to build on successes in the past on lead, and now to figure out how to scale up even further. And today we hope to hear from you, but also we will hear from our panelists that will give an overview of what's going on. In particular, to discuss the significance of what's going on and how we can work together. We will also discuss some of the challenges that LMICs face, such as in drafting and implementing laws to safeguard their communities, to curb damage from lead exposure. And we hope that this will be an opportunity for you to listen, learn, and perhaps adopt any good lessons learned that you've heard today on the webinar. We have 2 main segments of the webinar. The first segment will be to hear from the panelists, which I will introduce shortly. And during this segment, you are welcome to put questions in the chat. We will then address those questions in the second segment of the webinar, which will be a Q&A session, where you will be able to put your questions in the chat and we will answer them verbally. So you can direct them either to a specific panelist if you would like, or just put them in generally, and we will turn to the panelists that are able to answer those. So without further ado, I'm now going to introduce the speakers one by one, and they will turn on their cameras, and then I will turn back and have each speaker give a 3-minute intervention on the first question that I will ask them. So let me begin the introductions. I am pleased to first introduce Ms. Elena Jardin from WHO, if you would turn on your camera. She's in WHO's Chemical Safety and Health Unit and is responsible for lead-related projects. She worked prior for the government of Moldova, and now she is working, in addition to many things on lead, on the Lead Poisoning Prevention Week, which was just last week. So we welcome Elena to the conversation. The next panelist I would like to introduce is Ms. Francesca Cenni. She is a program officer of the Science and Technical Assistance Branch of UNEP. She's the focal point for technical assistance for the Basel Convention and is responsible for technical assistance on emergencies in the Secretariat. So I'd like to welcome her to the conversation today. Thank you, Ms. Cenni. Then I'd like to introduce Mr. Mohammed Omotola. Mr. Omotola leads UNEP's work on waste lead-acid batteries in the Pollution and Health Unit in Nairobi, Kenya. And he has more than 20 years of experience in international chemicals waste management, and we welcome you to the conversation. Next, I'd like to introduce Ms. Sharika Whitlock-Ballingsley. She is in an IPEN member organization. She's in the Poison Information Coordinator for the Caribbean Poison Information Network, located in the University of Technology in Jamaica. She's a public health inspector by training, with over 17 years of tackling public health issues. Thank you, Sharika. Next, I will introduce Ms. Nafisato Sisse, who is working with the Lead Exposure Elimination Project. She's a program manager and team leader there and works with governments and industry in 16 countries across 3 continents to end the availability of lead paint. She was previously with WHO and UNEP, and we welcome her as well. Next, we invite Mihaela Palm to turn on her camera. And she is a program management officer with the Knowledge and Risk Unit at UNEP's Chemicals and Health Branch in the Industry and Economy Division. And she primarily focuses on the provision of project and program management to prevent, minimize, and ensure the environmentally sound management of POPs, and works on pesticides and lead paint. Thank you. And last but not least, I will introduce myself. My name is Angela Bandmer. I'm with the United States Environmental Protection Agency, Office of International Tribal Affairs, and I spearhead EPA's work on promoting the capacity building in lower and middle income countries on lead. I have worked on lead and gasoline through the Partnership for Clean Fuels and Vehicles. Now I'm working in the Global Alliance to Eliminate Lead Paint, and I'm active in the conversation in the G7. So I will be giving that overview shortly. So with that, I think we can turn to our first segment. We will have a 20-minute conversation where we will have the speakers answer 4 questions. And we're going to start with a first question, and each speaker will have 3 minutes. So I will be keeping time and invite you to be brief and give verbal interventions. And I invite those listening in to put questions in the chat where we can answer them in the second segment. So the first question is, could you briefly introduce your organization's or your country's role in addressing lead exposure? What low-hanging fruit or immediate actions have you prioritized? And how do these efforts contribute to the global goal of reducing lead hazards? So with that, I would like to turn first to Ms. Elena Jardin from WHO. Thank you.
Thank you very much, Angela, and hello, everyone. WHO identifies lead as one of 10 chemicals of major public health concern needing action by member states to protect the health of workers, children, and women of reproductive age. So the WHO's primary role is to set standards where needed, provide guidance to member states, and to lead to advocate for change. Since 2011, WHO has jointly led activities with UNEP to eliminate lead paint and established the Global Alliance to Eliminate Lead Paint, chaired by US EPA. Since 2011, 40 countries have established lead paint laws, and 105 contributors have joined the alliance to accelerate this movement. The Advisory Council includes 20 governments, 5 intergovernmental organizations, 49 non-governmental organizations, 22 industry representatives, and 7 academic institutions. In June this year, an extended advisory council members met to validate the findings of the draft progress report prepared for ICCM5. Participants shared success stories and provided inputs for future activities of the Alliance, considering the future direction of the new instrument, which was recently approved. Last week was the 11th International Lead Poisoning Prevention Week of Action, and 120 events were registered on the WHO website. 56 countries organized different events worldwide, but we know that many more were taking place in different regions and in many languages. As you know, there is no level of exposure of lead without harmful effects to lead. It is well established that even minimal exposure can lead to lifelong development and health issues, and children are particularly vulnerable to the harmful effects of lead. The signs and symptoms of lead poisoning in children may easily be confused with general malaise, abdominal cramps, or anemia, particularly in low and middle income countries. Healthcare providers, in particular family doctors, community nurses, pediatricians, obstetricians, and midwives, should be trained in identifying the sources of exposure and other risk factors for lead exposure. And the prevention, diagnosis, and management of lead poisoning is critical. The WHO guidelines for clinical management of exposure to lead recommends a blood lead level of 5 micrograms per deciliter. And this is to review the ways in which a person is being exposed to lead and for action to reduce this exposure. For mentioning this, I would like to inform you that to further support this, WHO has published a series of training modules on lead poisoning detection and management, as well as an UNICEF WHO joint online course for frontline healthcare providers, which presents another important tool for capacity building in countries. Thank you, and looking forward for a successful meeting today.
Thank you very much, Elena, for the overview of that incredible work. And now we're going to turn to Francesca Cenni of the BRS.
Yes, good afternoon to all of you who joined this webinar, or good morning, depending on where you come from. It is a pleasure for me to present the work that is being conducted under the Basel Convention. The Basel Convention includes hazardous and other waste and lead containing, contaminated, or consisting of lead. Hazardous are defined as hazardous waste, so they are fully under the Basel Convention. In 2004, the Basel Convention published a technical guideline on environmentally sound management of waste lead-acid batteries. And this work is now being updated. In 2002, the parties decided to update this technical guideline. And the expectation is to have a new guideline perhaps in 2025. And this guideline is being developed by a group of experts, which is very large. More than 100 experts are contributing to this new text. And this group includes recyclers, includes large associations of battery producers, the member states of the Basel Convention, NGOs, also signatories like the US government, signatories of the convention, and broader advocacy groups, and also soon we hope the WHO and many other international organizations. So the guidelines cover different aspects of waste lead acid batteries management, from the legal frameworks, from the collection, the temporary storage, the pre-treatment, the recycling, the final disposal, safety, protective equipment in the management of the waste lead acid batteries, and emergency measures. The guidelines have the let's say the big objective of becoming maybe the standard for a national law on waste management, on waste lead acid batteries management. And the aim is to include the newest best practices, the newest knowledge on the health effects of lead, but also the best practices, and to write out certain practices which are actually causing a lot of harm to people working in waste management and in waste lead acid batteries management. So in this work, as you can imagine, the Secretariat is also very active on capacity building and developing also other tools to help the countries to develop national legal frameworks for the management of this waste stream. So we have several tools, guidelines for the development of inventories, manuals for on the development of national implementation plans, for the management of waste lead acid batteries. We also have training tools online and of course face-to-face. And in this work, we have a great collaboration with UNEP and with the colleagues who will have presented and will present also after me, and we cooperate in the delivery of technical assistance to countries, sharing information, but also success stories and working together in this effort. So this is all from me. Thank you for this opportunity.
Yes, that sounds good. Thank you very much. That's very interesting information that you've shared with us. If you have any links to share, please put them in the chat. Next, we will turn to Mohammed Omotola of UNEP.
Yeah, thank you very much, Angela, and welcome to everyone on the webinar. I'll just be speaking with much more focus on Africa region, where I'm based in the UNEP headquarters in Nairobi, and where we're doing work on waste lead acid batteries. Just basically complementing what has been said at the global level, my colleague Francesca, also now narrowing down to the regional level where waste lead acid batteries management is a concern, and we have, in fact, with the support of the European Commission and also working closely with our partner Pure Earth, released a guidance manual for policymakers on the environmentally sound management of waste lead acid batteries. I've provided in the link in the chat box where participants can actually have a look and see, the manual. It's online, it's available in English. We also have a version in French, but we have not released that version yet. But you can actually already see the document online. And basically, the manual focuses basically on existing convention legislations and policies that could help stakeholders and policymakers at the national level, and also at the local level, in addressing waste-less acid batteries relab. Also, we look at issues around licensed operators and different sectors. As you know, the issue of waste-less acid batteries. It's basically an health and safety issue. We have people handling it at the informal sector, without personal protective equipment. We also have challenges around transportation and issues that we have in indiscriminate disposal to landfill sites and so on. So these are really major health and environmental concerns, and we've taken note of it, and of course made some recommendations in the guidance manual. We have also, through the support of the European Commission, undertaken 2 pilot projects to support countries, Burkina Faso and Tanzania, just for them to basically begin to develop at their own national level some kind of national strategy and policy document that would help them to address the issue as they see fit. But referring again to the guidance manual, there are several case studies in that document that is very applicable and very useful. We also look at issues around proper sites and facilities which are set up to address the issues of waste-lead acid batteries. Of course, in terms of location and in terms of placements and all that, including sources as well. So these are very key issues for us, and we continue to work with partners and stakeholders in this regard. And subject to the availability of finance and funding as well, we'll be able to do a bit more work. Pollution, of course, is a big issue for UNEP and also for the region. So we continue to push and make sure that we have proper delivery in this regard. And perhaps lastly, just to mention that through the support of the Africa Office, the Regional Office of Africa, whom we've also collaborated with here in UNEP, we've also been able to help and support Ghana looking at the transportation of waste-lead acid batteries as well. And we also are aware of other national efforts in countries like Nigeria and the likes, who are also, pushing the needle in terms of addressing this major concern. You would also be hearing from my colleague, who Mihaela Pon, regarding lead in paint as well, and perhaps even some other work on waste-lead acid batteries. Thank you very much, and that's it. Thank you, Angela.
Thanks very much, Mohammed. Thanks for sharing that link and for giving an outline of that helpful guidance. Now we're going to turn to the next speaker, but first I'd like to say, when you do put your question or a comment in the chat, please note the organization you're from and the country you're from. Some of you are doing that, but I encourage everyone to do that. Thank you very much. So now we're going to turn to the speaker from the IPEN member, the Poison Control Center in Jamaica, Ms. Sharika Billingsley.
Thank you so much, Angela. So first, I'll just give a brief on IPEN and the work that IPEN does. IPEN, it's a network of 600 NGOs, 120 countries, and it's a movement that look on issues that has to do with toxic exposure, specifically to policies that can be had in country. And we have done lots of groundbreaking research. Now, how does my organization, being a member of IPEN, add to this work? So the Caribbean Poison Information Network is located in the College of Health Sciences in the University of Technology, Jamaica. And the focus of our work in regards to lead exposure and lead poisoning has to do with disseminating information on poisoning, specifically poison management, programs that speak to poison prevention, and also other programs that has to do with public education with our partners in the relevant ministries and also with media. We specifically try to target specific populations that are affected in Jamaica, vulnerable communities, and also institutions that deal specifically with children, because we are very much aware that lead exposure really is a big problem for children. So presently, Jamaica as a country has been tackling this issue through the programs from my organization and also with the collaboration with other agencies in developing what we have called a regulatory framework for lead paint, so we are able to monitor or control the use of lead paint within our country. Thank you so much. Over to you, Angela.
Thank you very much, Sharika, for that update on work in Jamaica. It's well received, and we are encouraged by this. Let's turn to our colleague from the Lead Exposure Elimination Project, Nafissatou Cissé. Please take the floor.
Thank you very much. As mentioned earlier by Angela, I work at the Lead Exposure Elimination Project, LEAP for short, which is an international NGO with the mission to eliminate childhood lead poisoning. And we work across 3 continents, which are Africa, Latin America, and Asia, with national governments and also paint manufacturers. We are also a member of the Global Alliance to Eliminate Lead Paint, which has been brilliantly chaired by the US EPA for a few years now. And at LEAP, we chose to focus specifically on lead paint for 3 main reasons. And the first reason is that lead paint is unregulated in at least 71 countries around the world. And many paint studies have shown and continue to show that lead paint for home use is readily available. And the second reason is that lead paint is a major source of lead exposure worldwide. And once introduced in our homes and schools, lead paint remains a source of poisoning for many years. And the third and final reason for us is that lead is not a necessary ingredient in paints. As you know, safe and good quality and cost comparable alternatives are available. And in order for us to support countries and manufacturers to address lead exposure and protect the health of children, we've designed a 5-step program. And the first step in our program is stakeholder engagement, where we build a collaborative relationship with the relevant government authority in the country we are working with. In some countries, it's the Ministry of Health. In others, it's the Ministry of Environment. We've also worked with standard authority bureaus and environment management agencies, depending on the country. The second step in many cases where there's no data available on the presence of lead paint in a specific country is for us to conduct a paint study with the government to generate country-specific evidence of the prevalence of lead paint. And the third step is regulation implementation, which consists of supporting the government's efforts for introducing or implementing lead paint regulations where they already exist. After this, the fourth step is to engage the industry. So at LEAP, we work with paint manufacturers where we provide them reformulation support. And we do that through several steps as well. We engage them with no cost support, because we know from experience from other manufacturers who have switched to lead-free paint that the process can be costly. So LEAP makes sure that it is as efficient for them as possible. We provide them supply chain support to ensure that reformulation is a sustainable solution for them. We provide technical support with a well-experienced paint technologist to help achieve a successful reformulation. And after they've done the reformulation, we provide testing support so that the manufacturer is sure that the reformulated paints are of good quality and also a safe product for the customers. And the fifth and final step at LEAP is for us to conduct a follow-up study in the country of all the paints that are available in the market, to monitor the progress that was achieved, and also to identify the need for further support. So this is what we've been doing to contribute to the global efforts to eliminate lead exposure. Thank you, Angela.
Thanks very much, Nafisa, and your work, your 5-step work is indeed bearing fruit. So it's much appreciated in the Alliance. Now we're going to move on to Mihaela Paun, who is with the United Nations Environment Program and works also on the Lead Paint Alliance work. Mihaela?
Yes, thank you, Angela, and good afternoon, good morning, colleagues. It's also a pleasure and an honor for me to be here today with you. So, as was mentioned by Elena earlier, UNEP is leading together with WHO, the Global Alliance to Eliminate Lead Paint. And this is a voluntary partnership formed to prevent exposure to lead through promoting the phase out of paints containing lead. Moreover, UNEP is also implementing lead-related projects with financial support from different donors. So you have heard earlier a few insights from the work that UNEP was doing on lead-acid batteries, as mentioned by my colleague Mohammed, but also there were some other UNEP initiatives. One related to the lead paint, where a global environmental facility finance project implemented by UNEP with one of the components dealing with the lead paint was just concluded in June last year, and in there 21 countries managed to enact their lead paint laws. But also it was very successful due to on-ground piloting of different, over 25 SMEs, the small and medium-sized enterprises that piloted the reformulation of their lead paints. And this was a successful exercise. And basically this work also happens in the global context and global mandate. And it was mentioned in the beginning by Stephanie that a recent global framework on chemicals was adopted in Bonn at the end of September. And when it comes and for you to understand the links with lead in paint, the framework decided that one of the resolution of the international chemicals International Conference on Chemical Management decided that all existing emerging policy issues, with lead in paint being one of them, should transition on the interim basis, and it will be called now issues of concern as part of the new framework. So this will go on until the next session, when the conference should decide and determine their path. But the resolution also states that there is strong encouragement to all the stakeholders to continue their work as needed on all these issues of concern, including lead in paint. Therefore, the mandate is there, and there is a call for further work. So from our perspective, we are looking to base the next steps, considering the lesson learned from addressing lead in petrol and lead in paint. There are a lot of lessons learned, and you have heard about the success of lead in petrol. So building on ongoing initiatives and adopting a holistic sectoral approach is crucial in our views to maximize the impact of the intervention to address lead pollution, both looking at upstream and downstream aspects of the supply and value chain also. So, of course, this will require a concerted effort from multiple stakeholders and also a commitment to this sustained action. So that's all from my side this time, Angela. Thank you.
Thank you, Mihaela. This is indeed very important to learn from the lessons from previous successes. We welcome that. To round out the panelist presentations, I will, as moderator, but also as a panelist, give an overview of what the United States has been doing. As was said before, we chair the advisory council of the Lead Paint Alliance, and we also worked on the phasing out lead in fuels globally. So we do agree that we have many lessons that we can learn from, including the benefits of having a clear target, and also of involving all relevant stakeholders, from industry to NGO, academia, international organizations, to work together on the problem. And that was very critical for gasoline, as it is for paint. And also in the United States, we are looking to work across the US government agencies now. We have established what is called an International Lead Exposure Working Group. And we are working across US agencies to see what best practices and lessons learned we can bring to the table to share with lower and middle income countries. And to that end, we envision working with UNICEF to put together a toolkit to enable countries at the national level or even the subnational level to look at lead holistically and see what have they been doing in their countries, what still needs to be done, what are maybe some of the low-hanging fruits. So we hope to help roll that out. And we're also working through the Group of Seven, as was said before, to raise this issue on the radars of our Group of Seven member governments. And to that end, we're going to have another G7 expert meeting to follow on to the one that was held in Berlin last year, and that will be in a few weeks on November 21st. It will be a brief online meeting, half-day session, and we will be discussing possible next steps and concrete actions to take jointly. And finally, I think what the US government can offer in this space is the experience that we've had to reduce blood leads in our country. And so we are very interested in working hard now on lead paint to finish that, to help more countries pass lead paint laws, and to also look then at the next sectors that can be addressed after that. So with that, I will end my intervention as well. And we can now turn to the other questions. In terms of timing, I'd like to try and get to the top of the hour and then leave plenty of time for you to ask us questions. And I know there's been many put in the chat, and we appreciate that very much. So what I'm going to do now is turn to the panelists on the remaining 3 questions, starting with the question on which is about engaging a broader network of stakeholders and how that can be instrumental. Which sectors or groups do you believe need to be more actively involved in the fight against lead poisoning? And here I'll turn to Mohammed Amatola. And then the second part of the question would be, how do you plan to engage them? And then I will turn to Francesca. So let's start with Mohammed to answer the first part of the question. Thank you. And 2 minutes, if you can. Thank you.
Thank you very much, Angela. Thanks so much for moderating the session. In terms of sectors, I mean, waste lead acid batteries and batteries in general, we're looking at more around the electronic sector, and also the transport sector. Electronic sector being a lot of the cars are also becoming very vehicles. We also have it, which also links to the electronical part and also the transport part. We have released a flagship reports on the, that's UNEP, of course, on the importation of used vehicles, and a lot of vehicles, of course, loads coming into the Africa region, and you can imagine how much batteries are in those vehicles, which goes into the millions every year. And likewise, also you could also say that we're also trying to build more relationship with the energy and construction sector. Energy in terms of power generation for domestic use or backup power, as we find with inverters. A lot of homes do have that now, particularly in Africa region, where power is a concern for businesses and for domestic use. So that is that. And in terms of the construction side, in the guidance manual, there was a case study in the guidance manual about some of the flax from the waste lead acid batteries, how it's been converted at high temperatures and heated temperatures, mixed with a few other materials to produce building materials, for construction of roads and farmland, farm walls, and also for homes as well. These have also been tested and been seen to be quite safe as well. So these are the areas, and we. Through some support, and working with partners, we're looking to build on those relationships with those sectors. Over to you, Angela.
Thanks very much, Mohammed. I hadn't been aware of the construction sector angle, so that's very interesting. Now I'll turn to Francesca.
Yes. So from the point of view of the development of the technical guidelines for waste lead-acid batteries and the environmentally sound management is very, very important to have a broad network of stakeholders, because the problem is in many areas. First of all, of course, the government, but also the national authorities, which need to be aware of the problem related to the informal management of used batteries or waste lead-acid batteries. And then also NGOs play a very important role, because in many cases there is not enough energy in the government or in the local authorities to really reach out to communities and to vulnerable populations. And there is really a need for giving this information on the health hazards of informal management of batteries, of opening the batteries, of and clearly saying that these are not accepted or acceptable practices from an environmental and human health point of view. And so there is a broad role also for the private sector, not only the producers of batteries, the most important users of batteries in servers, for example, in ICT devices, and as Mohammed mentioned, those using the batteries in the mobility tools and programs or in cars. And so these sectors are really important, and it's important that there is a joint action by many actors at the international level to bring the different points of view at the national level. The health point of view is very important, the labor point of view, to really come to exposure levels to lead which are acceptable and clear when it comes to work exposure. And also, of course, the standards in the recycling, which do not exist. They are not very widely known, or this really need to be further developed. Also it's very important to link the national level with the local level and the community level, and to find a way of having a network at all these levels, not just global, not just regional or national, but really cover the different levels until the persons who are exposed to lead because of the incorrect management of the waste lead-acid batteries. So, and in terms of engaging them more, of course, this joint action could help, but also maybe new initiatives, new joint activities targeting the sectors that Mohammed, for example, was mentioning, which are currently lacking. Thank you.
Thank you very much, Francesca. Yes, it does seem like there's a need for reaching across all the different sectors, as I'd also stated, and it sounds like that would be very effective. Let's move on to the third question then, which is how are technological advancements and innovative approaches being harnessed to make a more significant impact in addressing lead pollution? So I'm going to first turn to IPEN to answer the question, and then to UNEP. So IPEN or Sharika?
Thank you, Angela. So in regards to technological advancement and how this has been harnessed, I look on two specific segments. Public education. So the different platforms in terms of IPEN, there are 5 social media platforms that are used to disseminate information all over the world so that everyone can be empowered with knowledge and how they can prevent, how they can act, and how they can be a part of the conversation. IPEN also has what is called a website, and on that website, you have resources that are available to persons who would like to access information. IPEN and also CARPIN use the technology of research. So we use research to find out what is happening and how we can recommend programs for countries and different interventions that are practical. Now, one of the main things that I would say that would come out of all these technological harnessing in terms of research is the information that is available for lead in paint, where you have an alternative. And that's one of the biggest achievements that a technological harnessing innovation can be done in any country, that there is a safer alternative to lead in paint, and that information is available and it can be optimized by industry. So I would say that's one of the greatest achievement, and it is applicable, it is doable, and it can have great significant impact if countries would pick it up and to go with it. Over to you, Angela.
Yes, thank you very much, Sharika. There is no reason to add lead to paint, and that is why, we believe this is something that can be achieved, and we encourage everyone to work toward that goal. Now I'd like to turn to Michaela.
Yes, thank you, Angela. And this it comes in a way to complement what Sharika was just saying, but also to add, to refer to also different angles when it comes to these approaches, innovative approaches and technological development. So I will talk from the perspective of lead in paint. So one of the innovative thing, in my opinion, it was innovative at the moment when it launched. It was the development and promotion of this model law and guidance, which helped very much. It was proven that it was very helpful, helping a country to regulate lead paint at the national level. So a very, in my opinion, powerful instrument that countries have used. And this was several times demonstrated through the project that I told you that it was just finalized by UNEP. And then it was mentioned earlier by Elena that there is no safe level of lead. But what this model law brings is it provides with the lowest and most protective regulatory limit that has been set in countries for lead in residential and decorative paints, which is the 90 parts per million total lead content. So of course, I think this is also based on some science before proposed. Another thing, and this complements what was said by Sharika, related to alternatives and what UNEP together with other partners, WHO and US EPA promoted, is the lead paint reformulation technical guidance. This is also an instrument that was developed to help address both capacity constraints and technical barriers to the substitution of lead compounds in paints. Of course, focusing on the needs of the SMEs for effective and efficient reformulation of paint. And when I'm saying this, if you have the curiosity to go into the guidance, you will see that it includes information on hazardous properties of lead and the lead compounds used in paints formulation, also general approach and steps of the substitution process, and presents the properties of different alternative pigments and details of key lead pigments, their functions and so on and so forth. So all this technical information which is now there, and it's meant to support the action at the national level. And then it also includes information on the role and types of dryers and case studies, which are really helpful. But also a list of selected international organization for standardization standards, right, and test method and so on and so forth. So I think it's a valuable compilation of relevant information when it comes to reformulation and use of alternatives. And maybe not least, looking at the countries that already enacted the law, we came with this lead paint law compliance and enforcement guidance. This also is to support parties to develop and implement compliance and enforcement strategy for the lead paint laws. And also, this is very important because it's not only to enact a law, but you need to put it in practice to make impact. So the guidance also provides examples of action paint manufacturer and importers can take to demonstrate the compliance. So thank you. I hope I didn't go over.
Thank you, Mihaela. No, indeed, I think those are very important tools that you and Sharika mentioned. And I would just note that as a model for other future source work, it might be something to consider. Model laws and enforcement guidance and enforcement principles do sometimes cross-cut, actually many times cross-cut different sources. So I think there's something to be learned for other efforts from the lead paint work. So having said that, perhaps Mihaela, you could put in the chat the links to the documents you've mentioned. That would be great.
Yeah, sure.
And our final question is the following. How critical is raising public awareness and engagement in your strategies against lead pollution? And what methods have been most impactful? How are the needs and voices of the most vulnerable communities being integrated into global and local strategies? So I'm going to turn to WHO first. Elena?
Thank you, Angela. Important historical exposures, such as from leaded petrol, are a thing of the past. And now 93 countries have established legally binding controls on production, import, and sale of leaded paint. So raising awareness and broad multi-stakeholder engagement are critical in demanding and working collaboratively for a change. The International Lead Poisoning Prevention Week of Action takes place every year during the third week of October, and the focus of this year's campaign is End Childhood Lead Poisoning. And we acknowledge that that from the panelists and from the participants, I can see people who organize events, and we are very thankful for broadening this issue and bringing into conversation lead exposure prevention. So this engagement is supported through a range of advocacy and technical materials, guidance, know-how, legal expertise. All is very critical, and as Mihaela mentioned, some very useful tools. But does this one size fit all? So with the successful completion of JEF project on eliminating lead paint, initiatives such as Global Alliance to Eliminate Lead Paint, International Lead Poisoning Prevention Week of Action are more even important to this momentum, address the remaining countries that have not yet implemented lead paint laws in one hand, and in another hand to begin and tackle the many outstanding sources of exposure that remain at the country level. So lead production is still growing, so we cannot afford to be complacent, and non-intentional presence of lead in paint should not be an excuse for non-action. So we look to the new global framework on chemicals to also recognize the remaining and substantial work needed to be done to make lead safe world and end childhood lead poisoning. It's possible that a broader remit could be given under the global framework of chemicals. So WHO also welcomes the interest of the G7 environment ministries in keeping a spotlight on the issue that will do this part. So WHO are very welcome these initiatives. We're also currently we are working on a set of guidelines for member states, which are focused on prevention, screening, and surveillance, and hopes to find a strong support for completion of this work and targeted work on countries moving forward. Looking forward to answering any questions that you may have later today. Thank you.
Thank you very much for that, Elena. And yes, it is incredible to see what's been happening on lead paint and where we can go, but also how those lessons learned can be used to address other sources of lead exposure, since there is no safe level of lead exposure. So let's turn now to LEAP to answer the question.
Thank you, Angela. So at LEAP, we also believe that increasing awareness on the scale and severity of the global lead poisoning is extremely important, and we have been working towards that goal, particularly awareness raising among policymakers in low and middle income countries and among those who can fund and support those countries' governments to overcome the barriers they have in implementing solutions. And so we've been writing articles in international news outlets, we've been giving interviews, we've also organized events and given presentations at international relevance platforms such as SciChem meetings and also meetings of the African Ministerial Conference on the Environment to reach the decision makers who attend those conferences. We've also been organizing national multi-stakeholder meetings, which include civil society organizations, so that we are sure that the voices of the most vulnerable are heard and taken into account. A specific example on how important and impactful awareness raising can be could be our work in Malawi, where after the findings of our paint study were published by the media there, the Malawi Bureau of Standards took swift action to implement mandatory standards limiting lead content in paints, which included taking steps to update the standard to specify a 90 ppm limit. And Malawi is now listed as it's listed on the WHO Observatory as one of only 10 African countries which controls lead in paints, and it is estimated that lead exposure has been prevented for hundreds of thousands of children in Malawi through this law that is now being implemented. And we are working with manufacturers, including the biggest paint producer in Malawi, Rainbow Paints, which has completely switched to lead-free paints. And so this shows you how much can be achieved through effective awareness raising. Thank you very much, Angela.
Thank you very much, Nafisa. Yes, Malawi is indeed a very good example. We hadn't even really been aware of the status of the law there, and when LEAP went there and found out, worked very closely with the government to make sure that there was an effective standard in place. And so I think we've been through all the 4 questions now, and we're doing well on time. We now have the second segment of our webinar, which is to turn to you, the audience, the participants. You have been posting your questions in the chat, and I'm going to open up the summary of those, and I hope to be able to direct you to those. And so what I'm going to do is, I think I'll go through what I've been seeing in the chat, and other things might be added. So my colleagues online can help direct me to those. So we'll try and go to everything as they were posed in order. And I will either try and direct to a panelist or open the floor and see if any of the panelists would like to answer these. So we had a question from Reginald Chiodi in South Africa. And that is what is the best methodology to engage local municipalities to be involved in segregation of medical waste in a landfill site? Is anyone here familiar with that work and could answer, perhaps BRS or someone from UNEP?
Well, from the BRS point of view, first of all, I would like to say that under the Basel Convention, you will find technical guidelines also on the environmentally sound management of this type of waste or medical waste. And then, of course, when it comes to work with the local communities, it is extremely important to work with the radio stations, with local media tools, sometimes even cars, which can spread the message with the loudspeaker, and of course in the local language to have instructions at the site. Like, for example, in this area, it is not possible to access or this type of waste must be disposed in this way or this way. Simple instructions. Or of course, the management of medical waste starts in the hospitals and also the structures which are providing healthcare, and that also is a very important step in the education of the community, because there you find the first collection sites and this temporary storage sites. So these are the important let's say stakeholders to train and to involve in the activities on medical waste. And perhaps other speakers have more to add.
Yes, thank you. Let's move on to the next question, which is from Niger, Dr. Hassane. The question is about a regional regulation. Has the ECOWAS standard been adopted by the Council of Ministers, and is it mandatory in all ECOWAS countries? And I believe that is a question about the lead standards and regulations in ECOWAS. Perhaps Mihaela has an update on that.
Yes, thank you, Angela. So we just put in the chat a story that UNEP was releasing in this September during the meeting of the International Conference on Chemicals Management that happened in Bonn. And that story includes a quote from a representative of ECOWAS mentioning that, yes, the regulation has been adopted and it's now mandatory in all ECOWAS countries. So basically, each country will need to translate this into their national legislation. So in the chat, there is somewhere the link, but I can copy again, where there is the quote from the ECOWAS representative. So I think
Great.
that could shed light in this. Okay, thank you.
That's excellent news. That is, I believe, 15 or 16 countries that when they implement those regulations, and the Alliance is working closely with some of the ECOWAS countries and is happy to work with others if they don't already have assistance. We have legal experts who can help with formulation of laws. So thank you very much, Mihaela. The next question is from Peter Akugizibwe, and the question is what measures are put in place for sensitization, especially of parents and children, about the risks of lead? So maybe I would turn to WHO for that, for maybe a quick answer to that.
Yes, sure, Angela. Thanks very much for this question. There are a range of materials available on the WHO website, which I inserted recently in the chat box, which provides you the advocacy materials and communication materials in a very user-friendly language messages, simple messages for parents and their children, as well as to help schools and maybe teachers in the schools to understand the issue and help us to escalate the message. But I would like to bring to your attention two main documents. One is on a communication guidance, which presents the steps to conduct a communication strategy, to organize an event, and to do an outreach to the stakeholders, to the interested stakeholders. And the second one is the steps on establishing laws, which is on the UNEP website, which brings you the steps, the simple steps to be undertaken at the national level. So basically, you have everything to take some action. And in case some technical materials are not available in requested language, or please let us know, and we'll ensure that we can help you to implement some of them. And I also wanted to share with you the toolkit for establishing lead paint laws, which is a very interactive presentation with different sections, understanding the problem, how to take action, what is the problem with testing, how to establish 90 ppm, what are the health arguments, why we are advocating for 90 ppm. So there are plenty of useful materials, which I really encourage you to screen our websites and the Alliance website to see what we have. And please let us know if you need anything for further support at the local level. We can put you in contact with some local person which we know that they are organizing some events or doing some action.
Thank you, Elena. I see, Shrika, you have your camera on. Did you want to add? No.
No, actually.
Okay.
Yes,
all right. No
yes.
worries. No worries. And yes. So the next question we have is it's from Samuel in Cameroon. Is there any data on lead in paints used for coating a house roof? And maybe I'll take a first shot at that. I believe there was some initial data. I'm going to have to check, maybe out of Guyana, where this is a practice where the roofs are painted. So I would have to get back to you on this, but I would also open it to the floor and see if any other panelists have heard of this as a source of lead. Not Samuel, if you'll put your email in the chat, I can reach out to you separately. The next question, excuse me, is also from Samuel in Cameroon. Is there any data on recycling the level of lead in used lead acid batteries in different African countries? So how much recycling is happening on used lead acid batteries in African countries? Maybe I'll turn to Mohammed on that question.
Sorry, Angela, I seem to have missed that that question. Could you mind repeat,
Sorry,
please?
yes, I'll repeat. Yes, the question is about the recycling level of lead in used lead acid batteries in different African countries.
Yeah, thank you very much. I mean, of course, lead is a material that still maintains its quality as you continue to recycle and reuse it. A lot of the recycling has unfortunately been handled through the informal sector, where you have seen a lot of breaking of the batteries and trying to, of course, remove the flak inside and even the maybe reusable materials in it. And I see in the chat box also the message from the gentleman from India speaking about waste management practices in organizations in India where, there's sorts of employment for, folks who are not that well off and providing some kind of income for them through collection and disposal in landfill site. That's basically been the trend. We have seen efforts in some countries where plants have been established to deal with the waste from lead acid batteries, but they also have some local challenges because they don't get enough, material coming to the centers. Some, of course, still continue to use informal sectors, and when you try to, formalize them and look at extended producer responsibility in these areas, there's been some challenges we find there, and also there's also some constraints around, regional imports from other countries to the country to the country where they have the facility. So the plants are not everywhere. It's just in few selected countries, and even in those cases, there's still some challenges. So there's still a lot of work to be done, and I think working with national authorities and state at a national and state level, that's very key to getting that work moving. Thank you.
Yeah, thank you very much
Cheers.
for that perspective from Africa. And I'll just encourage all the panelists just to turn on their cameras now, just so that we can be more free-flowing in answering the questions. And the participants can see us all. Thank you. So let's turn to the next question from Atalo Belay. How can the community be engaged in lead paint elimination and lead acid battery management? Any experience from the countries you work with? So I'll open it to anyone who has experience at the country level, perhaps Mohammed to kick us off, maybe also Francesca.
Yes, I mean, it's not a new area, but again, there's a need to get all the key players involved, and I think that there's been so much work done at the sub-community levels and also through working with private sector and civil society organizations. There has been some case studies in the guidance manual, which I would invite participants to look at closely, that also offers some of the experiences and challenges that's been seen. For example, in Dakar in Senegal, and also even in here in Kenya near Mombasa, where there was some activities going on through lead acid batteries recycling and handling, which the impact has, of course, been felt in communities and so on. So I think this is where a lot of the focus is going on, because there's some wealth in the waste, but also there's some challenges around the impacts and the risks involved. So this is, of course, conversations that are still going on, and we're even looking at possibility of undertaking some other projects that would offer some kind of relief or support in those areas. Thank you.
Great, thank you, Mohammed. I see Mihaela posted also findings from the Lead Recycling Africa project, so we can look at that as well. Turning to the next question from Fatima in Ghana. Illegal mining areas are more prone to the effects of lead pollution. These communities need more sensitization. I think that's mainly a comment, and I think it's well received. I believe that UNEP and others, WHO mentioned, involving especially civil society that can represent these voices, I think is going to be important moving forward, because, as we know, even the vulnerable populations are even more susceptible to lead poisoning due to other co-occurring factors, such as, low calcium levels and other nutritional issues, etc. So does anyone else want to address the idea of these illegal mining areas and other areas prone to lead poisoning? All right, let's move on to a question from India. India has one of the largest populations in the world and have an increasing pollution. However, our Prime Minister has promised to reduce pollution, which is causing TB and other health hazards, destroying nature, and polluting our rivers with lead poisoning. How can you all help to reduce and improve our environment? So we're talking broadly lead pollution in India. Perhaps UNEP or WHO might want to address this one.
Maybe I will start and then Michaela can continue. Indeed, this is a broader aspect of the problem. And therefore, this year, WHO initiated a discussion to broaden the concept of bringing our multi-stakeholder engagement into this aspect. So we wanted to initiate and to continue discussion with partners later or starting in February next year by bringing together the contributors to the Lead Paint Alliance. And maybe we'll continue to discuss these aspects, how we can improve and how we can prevent pollution. But the first thing is to identify the hotspots. And as I mentioned earlier, WHO is working on developing guidelines on identifying hotspots on preventing the lead exposure. And we wanted to have support from other partners to develop these guidelines, and then to have a targeted number of countries to implement the guidelines on identifying that the pollution and helping to develop the specific guidance on how to prevent lead exposure in countries. And of course, it's depending on each individual country to identify the sources of exposure, and helping to understand, and also to help us to understand what is needed. For example, in India, is it needed to identify the hotspot? Is there a need to assess the risk, to do a risk assessment of the population, to see the average of the exposed population? Is it a need to assess the health status of children under 6 years old, for example? So it's really a complex problem which needs to be addressed in a holistic manner.
Yes, thank you. And I think there is an effort to stand up a working group in India to develop a national strategy on lead. The Pali Foundation is doing that. So if you put your email in the chat, I can put you in touch with them. So let's move on. We have quite a few more questions and only about 10 more minutes. I'd like to get to as many of them as we can. Those that we don't get to, we can follow up afterwards as possible to get you those answers. We have another question, an opinion from Vinayak about the education level in India, in villages especially, and dye companies pumping dye waste in villages and reaching water lines of the wells where several kids have died and many plants. Villages complain to the government, but nobody pays heed. So again, this is about the disadvantaged rural communities in India and likely other countries. And again, I think UNEP and WHO and others are making a great effort to engage the multi-stakeholder communities where civil society can have a voice. So I would think that engaging organizations in India and elsewhere who can give voice to those people will be the best way and the most helpful way forward. Just moving on, since we had already addressed that a little bit, I'm going to move on to some other questions. We have, okay, I think, did I cover all of them, Gayan? Or am I missing some?
Yes,
I'll go through
Angela.
the chat. You sent me another. Yeah, go ahead.
Yeah, I think you've covered many of them, and I just have one more additional question. This is from Fatima.
Yes.
Maybe you can,
Sure, thank you, yes. Thank you very much. I have Gayan helping me scan the chat since I was keeping time and managing. So thank you very much for that. Another question highlighted here from Fatima Ishun. Public awareness on lead is critical in reducing health implications of lead. The media has played a key role in awareness creation. Interactions with vulnerable communities to share their stories has been helpful. However, there is limited government commitment to this. Yes, depending on what country you're from, of course, this is always an issue. I guess I can just share from the perspective of EPA working on lead in gasoline and lead in paint, that sometimes that is the dynamic where the government commitment to this is not where it should be. And I think that, again, using the US experience, perhaps we would be willing or happy to share how we were able to do this. And over time, it took us a while as well. And we currently work across sectors in the government to bring the multi-sector governments together. And then we also have public processes where communities can provide input to the government on what we should be doing on lead. So we have a Children's Health Advisory Committee that tells us, what are their needs. And we very much have been focusing on what we call in the United States environmental justice, which is basically working with vulnerable communities, more exposed due to placement of industry, but also more vulnerable due to health issues. So that is something we very much have done here in the United States. And we hope to provide this expertise through the UNICEF toolkit as well. Maybe I'll turn to WHO and then maybe UNEP and others to address this idea of vulnerable populations and government commitment needed.
So I can add a few things, maybe, Angela, and also to complement what Elena said earlier. So I think it is important to have this holistic approach, at least when it comes to addressing lead pollution. And I totally agree that a multi-stakeholder process is very much needed to be able to pull this out. But also, I think having in regard how the government work, how the policymakers work, I think there is a need to bring forward maybe the evidence-based science also, and in particular looking also at the most vulnerable, in this case children, indigenous people, I don't know, other vulnerable groups, because usually how policymakers and decision makers work, they need to have also strong evidence that on the impact of different chemicals. And it's not only lead, we have many other groups of chemicals that impact. So usually from UNEP side, we are always promoting evidence-based decision making. I think it's very important, and it can also address effectively the issue when we are based on facts, on science, and so on. Most of the time the science is there somewhere, but I think there is a missing link between those producing the science and the policy decision makers. And I think it's very important to strengthen the science policy interface as well, because maybe this could be one of the drivers of change also in the minds of the decision makers. Thank you.
Yes, thank you. WHO or others, would you like to respond?
I would like just to add that from our experience during the GEF project, we observed two pathways for success. One is for decision policymakers to write a policy based on the evidence and based on the science, which Mihaela mentioned. And another one is for those policy makers to bring that information to the decision makers, to the politicians, and help them to understand why this is needed. So it's not just as my previous speakers mentioned, that it's a cross-sectorial coordination and engagement, because we need to have some policy briefs. We need to have some arguments for politicians to take action. We have everything what is needed for countries to write a policy, but it's difficult to implement a policy with limited resources, with gap in limited time or so on and so forth. So we have this experience in our previous work. And so what is important to bring that arguments to the politicians by presenting the information why this is needed at the country level. And also yes, I had something also in my mind. We know that from previous experience that some countries are facing some challenges, but we have success stories and successful examples when countries grouped countries were able to group with other countries in the same region, and then having assessed the economic impact and the health impact from the sub-regional level. And then it helped for the countries to argument and to give that assessment from the economic point of view and the health point of view to the politicians to have that regulation approved at a later stage.
Yeah. Yes, those are all really good thoughts. We have a few more minutes, and I think it's time to begin to close the meeting, unless anyone had any final quick interventions they'd like to make. I think this was a very good session. I'm appreciative of those who have stayed on through the whole session. I think almost everybody did, judging from the numbers. So we very much appreciate the opportunity to share with you our thoughts about what can or could be happening on lead in lower and middle income countries, and we've taken your questions on board. We will follow up. But what I have heard is that there are efforts ongoing, both in the United Nations, the international government organizations, but also in other organizations, working at multiple levels, at the global level to raise awareness globally, and to develop guidance globally, at the national level to work with governments, at the regional level, and even at the community level in some cases. And what I hope this webinar can help do is help spread these efforts across other countries, other regions, taking these ideas and using them in your country, your organizations. We very much welcome that. And we'd like you to stay tuned to more coming on lead. We direct you to the World Bank recent study on the economic impacts of lead, also a Pure Earth study on lead in consumer products. Perhaps someone can post both of those in the chat. If not, we'll follow up. It's a Lancet study and there's a Pure Earth study. So there's more and more information coming out about what sources there are globally and at the national level. So we look forward to continuing to stay in touch. And thank you again for being here. Thanks to the panelists, thanks to the host, thanks to the participants. And with that, I wish you all a wonderful day or evening, and we'll be in touch. Thank you.
And thank you, Angela.
Thank you, everyone. It was a pleasure.
Thank you very much.
Thanks for the opportunity.
Thank you very much. Bye-bye.
All right.
Thank you.
Bye.
Bye-bye.
Bye.
Bye-bye.